Here we have part 4, how do we manage a case on a budget, from diagnostics through to treatment.
So what do we do if we don't have much money from a diagnostic point of view? Just think about your turnaround times, the cost of the diagnostics, the treatments, the consults. Your mind is the cheapest analytical machine available. This comes to not just for FIP, for everything. So think about the likelihood of FIP. Think about those other differentials as well. We know that time is not our friend when it comes down to diagnosing and managing FIP. So think about what analysis we can do point of care, and we can certainly pare down quite a lot of it. It's not ideal, we know that much, but we can certainly kind of hedge our bets with what we need to do if we need to preserve it for treatment. But we also do have to do due diligence to try and rule out our suspected likely differentials. So we are going to be wanting to do PCV total solids. We are going to be wanting to do a kind of basic biochemistry, look to see what our albumin's doing, look to see what our globulins are doing, to try and look for evidence of hyperalbuminemia. We're going to be wanting ideally to check FIV and FELV, see what that status is, think about whether or not they're going to be at risk of having toxoplasmosis. Are they a cat that goes outside? Will they catch wildlife? Do they eat raw? As again, other differentials for them potentially to have vasculopathy, to be ecteric and pyrexic. If they've got fluid present within their abdomen or in their chest, we want to be looking at it ideally point of care anyway, but maybe we should do it point of care and we've got changes that are consistent. We can potentially hold those samples before sending them all out to the external laboratory. Ideally, we would be doing that. We'd be getting a grown-up to have a look at them. Ideally, we would be kind of doing PCRs and immunocytochemistry as well. It's much more challenging to get a diagnosis for our non-effusive cases than our effusive ones, in particular where we're thinking that in an ideal world we might do aqueocentesis, getting samples of the fluid from the eye, or doing a CSF, or doing an MRI scan. Response to treatment as a diagnostic tool. Be careful if you're considering doing this. I'm sure that many people have done it, but we have also seen cats that were treated empirically, that had septic effusions, that had heart disease. So do think about what your other differentials are, and do basic due diligence, particularly where we've got effusive disease. So what can we do treatment-wise on a shoestring? So it's worth remembering that no matter what we do, we are likely still looking at thousands of pounds to be able to treat these cats. There aren't really any alternatives to the nucleoside analogues that can be recommended. There's either no, minimal, or very limited data with them, or limited effect in isolation. And some of the medications where it's described, the use is described, again, no or minimal or very limited data, certainly no better, and some of them are no cheaper. But where you are very, very limited, you could consider the shorter treatment courses, say a 6-week one instead of a 12-week one. Again, ideally with those, you need to make sure that you have a near normal, if not normal cat, a good few weeks before we start thinking about stopping that medication. And I appreciate these are the ones where ideally you would do the scans to make sure it's fine, you would do the bloods to make sure the alpha-1 glycoprotein's okay, but it's having a chat with these owners about, by not doing those tests, what you might be missing. Definitely want to be thinking about going straight to oral medication as well. Injectable medication is, and the need to give it in a hospital setting from an intravenous point of view, it certainly does limit our options there, and it's more expensive. Again, limited monitoring. In terms of what's going to be helpful for us, we know that most of the blood tests we do are going to be helpful in one way, shape or form. Measuring alpha-1 glycoprotein is going to be very helpful to assess response. Measuring albumin and globulin is also going to be helpful too. We want to be seeing that globulin's eventually coming down. We want to be seeing that albumin to globulin ratio more normalizing as well. But similarly, we want to make sure that they're not developing a hepatopathy, that they're not developing anything else. We have previously talked about mefloquine, so Larian tablets, very, very cheap, nowhere near as effective. We've used them in the clinic sometimes to tide animals through over to having oral versions of the medication, and I know of a group in Australia that were trying to look at its use as an alternative to the other nucleoside analogues. Unfortunately, it was the inferiority levels of it was such that actually wherever possible they were trying to reach for the nucleoside analogues. But it is something that could be considered, particularly alongside kind of the nucleoside analogues where it isn't possible to increase them. But on a shoestring, don't underdose. It does appear that we do need to achieve a certain level of dose within our patients, and it's much better to go for a shorter treatment course and an adequate dose than vice versa. And we also want to be really, really careful. We don't want to be recommending illegal preparations that may be present. We don't know what goes into them, and we don't know what doses they are either. So other common questions that kind of crop up. So we do have people saying, what about vaccination? So we follow the WSAVA vaccination guidelines. So it really depends on how old your cat is, whether it's had its first round of vaccines, whether it's had its 1-year booster. And we would be recommending vaccination according to requirement if they're clinically stable. So most of these cases can wait. What you want to be doing ideally is be waiting for a few months after you've completed your treatment course before thinking about vaccination, and then only giving what they need to be given. Flea treatment, worming medication as preventatives, not a problem at all. So you can keep on happily giving those. In terms of neutering and other elective interventions as well, now, sometimes we will do this kind of alongside treatment for FIP once they are clinically stable in themselves, where actually we feel that it's necessary from a welfare grounds point of view. So what we're talking about are cats that need to be rehomed because they're in a rehoming shelter situation and they need to be neutered. So again, we would absolutely neuter those so that we can get them out of there sooner rather than later. Another situation may be that they are frequently calling and frequently trying to escape and causing havoc in the house and potentially more stress in the house. And again, absolutely it is okay to neuter those patients because we feel that actually it's going to be less stressful with them neutered than it is with them kind of entire and in season. But where we are doing it, we want to be really kind of what we're doing all of the time with our cats is kind of minimizing stress. And we want it to be done in the most cat friendly way possible. But while they're on antivirals, we're going to be wanting to keep them on treatment whilst we're doing it, and then probably really wanting to keep them on the medication for at least a couple of weeks afterwards. So we want to get them through that stressful period whilst the antivirals are on board, or we're going to be wanting to wait for about 3 months following treatment. In terms of what about coming into the future, so medication wise, we still just have the EIDD 1931, we've got remdesivir, and we've got GS 441524. They're not licensed, they are just products that are produced by companies such as Bova and Summit. It's one of the reasons why they can't be advertised to us as vets. So at some point we may get a licensed product, we just don't know that. I would imagine it's quite a challenging situation to be in. I'm not aware that this has cropped up previously. It may be possible that we do get protease inhibitors like GC medication that has been previously described. There have been some talk about it, but the talk has been for a number of years now. They are definitely looking at it for use in people with COVID and other coronavirus related diseases. So we do need to kind of wait until they've done that from the human side of things before they start putting it into cats likely. From a diagnostic tools point of view, there are going to be more studies that come out looking at machine learning to predict diagnosis, particularly from our routine blood work. So that is likely to come out in the next few years to help us as vets make that diagnostic decision. There's also going to be likely more studies that come out that look at some of these genetic risk factors, and it looks like similar genes are implicated in cats that have FIP as in people that have gone on to develop severe COVID signs. Treatment protocols, they are continuing to be refined, both in terms of dosages, durations, dose frequency that we're giving. So again, keep your eye out for that. That has been one area where there's been a lot of change in recent years, and I suspect it will continue to change over the coming years. And in terms of prevention, vaccination, vaccination has come up historically. They looked into doing it in the 1970s. They weren't so successful with that in terms of there wasn't a product that they found that was recommended. There's one that is available in the States, but it's not recommended in the States, and it's not recommended in Europe, and certainly not available in the UK. But with modern techniques, it may be possible for us to vaccinate our cats. There is also the question as to what age do we vaccinate them. Most of our cats are exposed to coronavirus before we would even vaccinate them against anything else. And again, we would need to think about when our risk window is from an exposure point of view, and whether we'd need to repeatedly vaccinate these cats, like is required in people, to provide us with protection. So again, it's something that we would need to consider in the future. Again, something that where I'm sure there's going to be a lot of active investigation. In terms of where to go for more resources, as we said before, advice is constantly changing, especially drug dosages. So do ensure that you are up to date when you get a case in. At the moment, we're still frequently using FIP advice. I help out in answering some of those questions. So do some of my colleagues on the FIP advice team. We've been supporting vets for over 4 years now. It's been amazing. In part because the companies that supply the medication, they can't do it legally because they're not licensed to do it, they're not licensed to recommend it, and so that's what we're there for. It's specialist support, it's by email and open access publications. So we've published in ISFM and in practice every time we feel that it's warranted to change our recommendations. We also provide owner support documents as well. We also help to update ICAT Care, so there's information for vets and owners on there, and then also in parallel and including people that are also on the feline FIP advice kind of advice team is ABCD Cats Vets. So again, a wonderful website for various infectious diseases, including coronavirus.
Thank you for joining me on this journey through diagnosis and treatment of FIP. If you'd like to see more videos like this, do please subscribe to the channels, like it as well, pass it on to your friends, and do just let us know if there are any other areas you would like us to cover in the future. If you don't ask, we're not able to help you with that.